Yes, my name's Mike Woodward. I'm the head of nursing for infection prevention control at the Countess of Chester Hospital. I've worked at the Trust since 2000 and been in IPC since 2008. So in terms of the MEG audit tool, really, we had a very archaic system of audit prior to adopting this, 2-3 years ago now. It was very much a paper-based audit process. We did have some very ancient old little software that we would input our audit tools in, our audit reports into. We'd have to come back and download onto the computer, and there was a lot of manual typing up of any content, any narrative around the audit. And then if you wanted to add any illustrations, pictures, you'd have to take them on your phone and then email. It was a very time-consuming process to do the audit and then to disseminate the results out. People would you just email people individually, and nobody would have that broader view of the audit findings and any themes or trends, etc. So yeah, it was very behind the times in terms of how we were delivering our audit program. And then moving on to MEG, my predecessor had used it in another hospital and suggested bringing it in. So it took a while to get the approval, but once it was brought in, it's basically revolutionized how we deliver our audit program. In terms of the time it saves as well, the slickness of the audit process. We can go out and do an audit, and then the report is disseminated immediately to the audit area. It's got the visuals on there on the action plan, and then we've broadened out who can have access to the dashboards as well. So at the moment we've got over 80 members of staff in the trust, ward managers, matrons, heads of nursing, who've all got access to the dashboard, so they can see clearly their audit data. They don't have to contact us to see that. So yeah, it's kind of just revolutionized how we deliver our program, but how we share that with other people as well. And the more people that are having access, that's kind of having a snowball effect, and so more and more people want to have access to the MEG dashboard as well, to be able to see what the audit data looks like, to look at the themes and trends. So it's and it's really it's of such value at the moment, because we're the monitoring of the practices we're doing. We are seeing some gaps in assurance in relation to IPC practices. So there's a real focus from our executive team on what the outcome of our audits are. So it's integral to how we deliver provide our assurances in relation to the care that's being delivered at the moment. So it's we couldn't function without it now. I don't know how it functioned before we had it, really. So